This segment is sponsored by the Pediatric Headache Center of Richmond.
Migraines and headaches can be disabling for children and adolescents and can impair their quality of life. The Pediatric Headache Center of Richmond is dedicated to finding the source of their patients' pain and bringing them relief. Dr. Allison Alford joins us this morning to cover diagnosis and treatment options. Allison, it's great to see you back. Thanks for being here.
Thank you. I'm glad to be here.
We talked before about the Pediatric Headache Center of Richmond, but for anybody who maybe hadn't seen us that day, remind us what this is all about.
So we see patients, we really birth if you wanted to 21, and it's everything for headaches under one roof. So we have acute therapies, we can do IVs, we do nerve blocks, which is one of the things we're going to demonstrate today. And we do regular patient visits, medication follow-ups, all that stuff in one space.
Marley Robertson is with us today. She's one of your rare adult patients, right?
Yes.
She's going to help us with this demo. But before we get there, back to the question with young people. Birth to 21, how do we know that babies are suffering from these headaches?
There's actually, and there's not much we're going to do about it typically in babies because you don't want to put them on medications or therapies, but there's actually a lot of research that's starting to link colic to being a migraine precursor. And you start to ask some of my elementary school kids, they say, oh yeah, they were a colicky baby, they were fussy. And so, I mean, obviously not every colicky baby is going to have a migraine, but there are some evidence that they show signs even that young.
Interesting. Yeah. It is fascinating. And as they get older and as they're able to communicate, you begin to learn these headaches certainly can be debilitating. When we said affect quality of life, it really just prohibits.
Absolutely. There's lots of people I have that they can't go to school or can't go to practices after school or friendly functions like prom, stuff like that. They miss out on life a lot.
You have a procedure you're calling an SPG. What is this?
So it stands for sphenopalatine ganglion. Hence the reason we say SPG a lot shorter. But it's a group of nerves at the back of the nose. It's actually the largest collection of autonomic nerves outside the central nervous system. And so what we do is this device that we'll show you. It actually goes through the nose. There's no needle attached to it. It's really a nasal spray. You spray one squirt on each side. It numbs up that group of nerves and actually provides long-lasting relief from the migraines. So it's minimally invasive. Yeah.
You're going to give us the demo. We can do it right here. Marley, you're going to help us with that. Let's get started on the demo. And of course, Dr. Alford, you said this would happen on both sides of the nose. We're going to demonstrate one side today.
Yes. Let me get my glove on.
Marley, she'll take care of you on the other side later on.
Yeah, we're not going to have treat her, I promise.
But this is a treatment that happens. I mean, Marley's fully awake.
Absolutely.
This is an in-office treatment.
Yes, absolutely. It takes seconds. So normally we would draw up the medication. And again, I like to point out to kids that the needle comes off. I don't lie. There's no needle involved, I promise. And this is the other half of the device. And we'll attach the two pieces. And this is actually what goes back her nose. It's a flexible catheter. So there's no needle on the end and it doesn't hurt. All right.
But that's for application to get it in that cavity. Okay. So this is happening.
It goes into her nose just a little bit. And then it's going to go all the way back. And then you just push the drug through and the whole thing comes out and that's it.
And then that's it.
That's it. And then we do the other side.
Okay. So Marley has, I will just go ahead and tell you, a green apple Jolly Rancher. This is already happening.
Yeah.
That's part of the methodology here.
The medicine that goes back, whether it's bupivacaine or lidocaine, to numb it up is bitter tasting. And so since we're spraying literally at the top of their throat or the back of your nose, whichever way you want to look at it, the excess is going to drip down. So we have Jolly Ranchers in the office, blow pops, mints, whatever they want to suck on, and it helps keep the taste. It's not perfect, but it's better than doing it without. Makes it tolerable.
Yeah. That was so very quick. For us, it seemed easy. How does it feel?
It just feels kind of like you have drainage when the medication actually goes down your throat. And it's only a little bit. And then also you probably noticed that I did tear up a little bit, not because of pain, but because she hit the right spot when she got the medication, and that's just what happens when.
It's actually a sign for us that it went to the right place. That ganglion helps part to make your eyes water. So one thing we always ask, did your eyes water? Yeah, it didn't hurt her. It just that's actually a natural effect.
I would almost think it's a tear of joy from having relief of this happening. Exactly. We're out of time, but I'm just so curious. This is instantaneous relief, and then how often is this therapy repeated?
It depends on the person. We have some that do one every 3 months. We have some that do one every 6 weeks. And in Marley's case, she was a little more intractable. She had to do it a couple times a week. And you do it for about 4 to 6 weeks, and then you get usually several months of headache relief from doing it.
Wow. Fascinating.
Yeah.
Marley, thank you. Dr. Alford, thanks for being back with us.
Thanks.
Appreciate it. We're going to share some information. You'll find the Pediatric Headache Center of Richmond, 2500 Gaskins Road. Learn more online, pediatricheadachecenter.com, or call 658-5385, and be sure to find them on social media, on the Facebook and on Twitter, PHCR4U, and that's the number 4 and the letter U. Right now, we're going to send it over your way.